Hi everyone, my name is Om Sagaram Dilke. My topic is plasma volume experiment. Let's we talk about my topic. So first, plasma volume expander have high molecular weight, the substance which when infused exert osmotic pressure and remain in your body for longer time to increase volume of circulatory fluid. There are two types. First, they are colloids. So colloids include dextran, polyvinyl pyrrolidine, gelatin, polymer, and hydroxyethyl starch. And also there is a next type is nothing but crystalloids. Crystalloid are nothing but normal saline, dextrose, and dextrose saline. So first we talk about the ideal plasma expander. Ideal plasma expander are have a oncotic pressure comparable to the plasma. Second, remain in the circulation for a adequate period. And third is nothing but they have metabolic degradation or excretion. So fourth is nothing but they are non-antigenic, non-pyrogenic. So next, not interfere with the group or crossing blood matching technique. So uses of the plasma volume expander, they are used in a hypovolumic shock, burn, severe trauma, and endotoxic shock. Contraindication of the plasma volume expander are severe anemia, they cause cardiac failure, pulmonary edema, and renal insufficiency. So we are talking this, and next slide is nothing but a colloidal plasma expander. They have high molecular weight, remain longer time in the blood, and augment volume of circulatory fluid by increasing osmotic pressure. First, we are talking about the dextran. Dextran are nothing but a polysaccharide, and there are two types on the basis of molecular weight. First is nothing but a dextran 17, and second is nothing but a dextran 14. Oncotic pressure similar to the plasma protein. Expand plasma volume for about 24 hours. So larger dose does not induce antibody production. They also interfere with the coagulation and platelet function, and also the blood grouping. So first we talk about the dextran 17. Dextran 17 is excreted very slowly in the GFR, and also some deposited in the RE cell, means reticuloendothelial cell. Next slide is nothing but a dextran 14. Reduce blood viscosity, excrete through the renal tubules, and occasionally may produce acute renal failure, and precaution should be taken. There will be caution. The dextran does not provide necessary electrolyte and cause hyponatremia or other electrolytic disturbance. They also use in the antithrombotic microsurgery and in some eye drop for lubrication to solubilize other factor as like iron dextran, and used in the laboratory test. Contraindications are the allergy, heart failure, acute oligouric renal failure, hypofibrinogenemia, thrombocytopenia. So next slide is of our hydroxyethyl starch. Compared to the dextran, main blood volume are longer, does not cause acute renal failure and coagulation disturbance. Adverse effect of the hydroxyethyl starch are anaphylactoid reaction and mild chilled, mild fever, periorbital edema, urticaria, itching, and chill. And then we are last, that is polyvinyl pyrrolidine, that they are the synthetic polymer having molecular weight 40,000. They will interfere in the blood grouping and cross matching, release histamine, so they will be the bind to the penicillin and insulin. So next slide is of gelatin polymer. They does not interfere with the blood grouping and cross matching. They have advantages. This advantage is helpful. They expand plasma volume expander for about nearly 12 hours, and they are non-antigenic, hypersensitive, hypertension can occur. Next is nothing but crystalloids. Crystalloids have a normal saline, very limited duration of action. Then dextrose. Dextrose have osmolarity is similar than serum and useful when kidney function is impaired. Second and last is nothing but a human albumin. We know about the albumin is helpful in the maintain osmotic pressure in our blood. So obtained from the plasma of human, and crystalloid solution must be infused concurrently for better action. They will not, does not interfere with the coagulation. used in the vehicle for transfusing packed red cell. Yes, we are completed our topics. Then we see the MCQs. The first MCQ, which statement about the plasma expander is false? First is, they are used in the case of excessive fluid loss. Yes. They are not used in the angina pectoris and MI. This is wrong. They will be the cause these things. They will use it in a hypovolemic shock, severe burn. Yes. Dextran is the most commonly tried to plasma expander. Yes. Dextran is the most commonly tried. Second is second. As a plasma expander, Dextran has a following advantage, except it exerts oncotic pressure similar to the plasma protein. Yes. It keep the plasma volume expand for about 24 hours. Yes. It is a non-pyrogenic. Yes. But it is a does not interfere with the blood grouping and cross matching of the blood. This is a except this is a not an advantage of the Dextran. This is interfere with the blood matching and blood grouping. Yes. Next slide. Dextran is used in a bleeding? No. Blood clotting? No. It is used in a blood transfusion. And second last is a blood preservation. No. This is not used in a blood preservation. Next, plasma expander with oxygen carrying capacity is. Which plasma expander have oxygen carrying capacity? Hemacil? No. Dextran 14. Dextran 14 have a capacity to carry oxygen. This is seen. They will no interfere with the blood grouping. Last, plasma expander are used in the following condition except they used in a congenital heart failure. This is the exception. This is for answer of this or question. Next, extensive burning. Yes. Multilating injury, endotoxin shock. These are all are the used in the plasma volume expander. First is congenital heart failure. This is not used in the our plasma volume expander. So we are completed these our topics. Thank you.